Thank you, Mr. President. Please recognize Senator Treat for the explanation of the Conference Committee report for Senate Bill 3.
Senator Treat, you are recognized for the explanation of Conference Committee report to Senate Bill 3.
Thank you, Mr. President. Thank you, Mr. Leader. The Conference Committee report to Senate Bill 3, I'll go through it where the monies are appropriated and talk about substantive language, take any questions after that. If you turn to page 2, we're appropriating $39,400,000 to the University Hospital Authority for the purpose of children's behavioral health. And I will go into more detail on what's on lines 8 and below here in a moment. We're appropriating $44 million to the University Hospitals Authority for medical records. We're appropriating $20 million for the purpose of creating a cancer center in Tulsa to expand the reach of Stevenson Cancer Center and fill a hole that exists in Northeast Oklahoma and be able to treat cancer. Then you go to section 4, we are appropriating $5,163,195 for the purpose of mobile dental units. The remainder of the bill deals with creating the accounts and having the accountability that is somewhat consistent and redundant to what we just voted on Senate Bill 1. The part that's getting the most attention lies on page 2, starting on line 8, that disallows the recipient of these monies to be able to perform gender reassignment medical treatment. This bill, if adopted and if the emergency passes, would stop that practice at OU immediately upon signature. And you can see the exclusions and the definitions following thereafter on page 2 on to page 3. Mr. President, I yield for questions, move adoption of the Conference Committee report at the appropriate time.
That concludes explanation of the Conference Committee report to Senate Bill 3. Will there be questions of the author? Senator Kurt, you're recognized for a question of the author on the Conference Committee report.
Thank you, Mr. President. The legislature passed legislation last session to create the Joint Committee on Pandemic Relief, a year ago, to create the Joint Committee on Pandemic Relief and to assign funds. Can you tell me the purpose of that committee?
To be able to vet the nearly $18 billion in a request for the $1.87 billion that we had to appropriate in a manner that was transparent, in a manner that tried to prioritize the needs of Oklahoma after we received input from the public. The majority of input we received was for water, broadband, and health, and this fits, this bill, the entirety of this bill fits nicely into that part about health.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. On page 4, it says such funds shall be utilized in a manner consistent with the recommendations adopted by the Joint Committee on Pandemic Relief Funding. Did the Joint Committee on Pandemic Relief Funding create medical exclusions in their recommendation of this funding?
Thank you for that question. The line you're referring to, I think it starts on line 11, and that is referring to the Stevenson Cancer Center expansion into the Tulsa, northeastern Oklahoma area.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. Throughout the bill, there's language about the consistency with the recommendations of the Pandemic Relief Committee. Did the Pandemic Relief Committee recommend these projects with exclusions for medical care?
Thank you for that question. The question you referred to on page 4, I don't see the exclusions. If you're referring to page 2, that was decided, and I don't know if that was discussed in the Joint Committee or not, but I do know there's been a lot of discussion in the public space about this issue.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. So when we committed to the Joint Committee Pandemic Relief legislative process, was that also an agreement that the funding recommendations would come through that process?
The funding recommendation of the $39.4 million came through that process, so yes. in order to get the much needed children's behavioral health money that we all agree, I believe, is desperately needed in the state of Oklahoma, we have to make some commitments that we believe are appropriate and prudent to be able to get the money to children's behavioral health.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. So in creating the exclusions for specific care, medical care for youth, you believe that's consistent with the recommendations for American Rescue Plan funding and mental health treatment for children?
Yes, I believe it is entirely consistent to appropriate $39.4 million to the University Hospital Authority to continue the investment that this state has made in children's behavioral health starting a year ago, and we are continuing through and using the monies of ARPA to expedite and speed that process up. So yes.
Senator Kurt, you are recognized for a follow-up.
Thank you, Mr. President. Can we anticipate other exclusions and strings attached to these funds that are being allocated?
Thank you for that question. All of the bills appropriating funds are available, have been posted since Monday on the Senate side, I know. And so the exclusions you see, I think are prudent. I think Oklahomans support them, and we must get this money into children's behavioral health.
Senator Kurt, you are recognized for a follow-up.
Thank you, Mr. President. Are there other mental health or behavioral health conditions that we will exclude funding for their treatment?
The exclusions to not perform gender reassignment surgeries and other procedures are the only exclusions within this bill. I am not presenting the other bills. However, you have them in front of you, and there are no exclusions besides this one, and this is a very appropriate exclusion to make sure that people under the age of 18 do not make decisions that are largely irreversible and life-changing. We have many statutes throughout our statute book that disallow people under the age of 18 from participating in various things, and I think that's entirely consistent in this bill.
Further questions? Senator Hamilton, you're recognized for a question of the author on the Conference Committee Report to Senate Bill 3.
Thank you, Mr. President. The concern about mental health for everybody in Oklahoma, but specifically children, I believe to be valid and well-founded. However, due to the concerns that you mentioned on page 2, which have been the subject of much discussion, has there or is there any consideration given to the removal of those people associated with the OU Children's Hospital who allowed such a thing to happen in the first place?
Thank you for the question, Senator. This bill does not entertain trying to remove people. This bill merely protects us. First, it doesn't merely protect us. It invests critical money in children's behavioral health, in medical records, in cancer, in mobile dental units, and it also provides a protection that doesn't currently exist in Oklahoma statutes. And you know, as a member of my caucus, that I made a commitment in caucus yesterday that we would pursue a more holistic path next session to make sure this doesn't happen in the state. But we have a vehicle in front of us to prohibit, the only one that I know of in the state that is performing any of these such procedures and providing also hormone treatment and other things. So you have a vehicle in front of you to stop it. As far as your question on point, does this bill do anything to seek any dismissal or any penalty for those who have participated in the past? No, it does not.
Senator Hamilton, you're recognized for a follow-up.
Thank you, Mr. President. Since this actually became a thing at a, and I use that word in air quotes, it's a situation that has arisen at a place that was ostensibly designed and funded for the care of children. And we didn't know about it until the summertime. Would it not be safe to assume that our knowledge of exactly who and where these quote-unquote services are happening might also be incomplete? And I have a follow-up after that, Mr. President.
Thank you. I readily admit that I do not have an all-knowing mind. And so, no, I do not know everything that is going on, but I can tell you in appropriating money to this critical service, we discovered this and we have acted to stop it going forward.
Senator Hamilton, you're recognized for a follow-up.
Thank you, Mr. President. Shifting gears for a minute, regarding the need for the urgency, I guess, as it were, for the money to be spent on pediatric mental health. Does it not give us some concern that if this entity was able to stand up this facility to begin with, that perhaps they should have been better stewards of that money initially and invested it in pediatric mental health instead of this foolhardy endeavor?
Thank you for the question. I don't know if you've ever walked the halls of OU Children's or OU Health, but I can tell you that they have provided extremely quality health care to even my own family, to friends who have had children with cancer that were on the brink of death. I applaud the overall mission and effectiveness and heart that they have. This particular program I was not aware of until June, and we have been trying to get facts on it, but I don't think it should muddy the waters on the critical part of our society that they play in protecting our health and promoting our health. We have an opportunity to stop what we all agree is, many of us, I should say, agree is an inappropriate intervention.
Further questions of the author. Senator Dossett, Joanna, you are recognized for a question of the author on the Conference Committee report to Senate Bill 3.
Thank you, Mr. President. Mr. President, we've heard throughout the line of questioning and answers that we all agree that the $39 million should go towards children's behavioral health. And my question is, if we all already agree that that money should go to children's behavioral health, why was it necessary to add this exclusion to get this bill across the line?
Thank you for the question. We became aware of a practice that many of us in this body do not agree with, believe is inappropriate. And in the moment of being able to provide for this critical service, we took action that we feel is appropriate.
Senator Dossett, you're recognized for a follow-up.
Thank you, Mr. President. And so do I understand correctly that this bill was not going to advance, this $39 million to children's behavioral health was not going to advance if we did not add this exclusion? Is that correct?
I don't know if that's 100% accurate. It definitely makes it a more difficult path because people want to make sure that we're not using taxpayer monies to perform a service that they find reprehensible and not a valid medical intervention for people, especially under the ages of 18.
Senator Dossett, you're recognized for a follow-up.
Thank you, Mr. President. Along a little bit of a different line now, I think we all, probably all in this body agree that the acceptance of federal dollars for any reason is problematic because federal dollars always come with strings attached, and sometimes strings that make allocation and implementation very difficult. Can you talk to us about the precedent that we're setting of adding more strings, self-imposing more strings on top of strings that are already attached when we accept federal dollars, please?
Yes, thank you. I agree with your sentiment that the federal government oftentimes oversteps with their strings. I think what we are doing here is protecting values in Oklahoma that we hold dear, many of us hold dear, that this is inappropriate. If a child chooses to do this oftentimes we limit their ability to make these type of life-altering decisions until they reach adulthood, and I believe this is entirely consistent with that.
Further questions? Senator Hicks, you are recognized for questioning the author on the Conference Committee report to Senate Bill 3.
Thank you, Mr. President. Mr. President, are you aware of the American Association of Pediatrics best practices recommendations for gender dysphoria?
I have, in my research, read that association's position. I've read the American Academy of Pediatricians. I've read AMA. So I'm aware, but I couldn't quote to you their position.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. Is it true that the current practices that are being administered at this facility are in line with the best practices from numerous medical associations around the world?
I have no reason to believe that you're saying something's inaccurate. I will tell you they are entirely inconsistent with what the majority of Oklahomans believe is appropriate medical care.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. Is it the position of this body to override what is leading medical research and science in order to conform individuals in this state into a box?
No.
Senator Hicks, you are recognized for a follow-up question.
Thank you, Mr. President. Then why are we considering this language today when it has nothing to do with the projects and the funding that we have been entrusted by the federal government to administer to relief to our communities?
It absolutely has a lot to do with it. The interventions done with behavioral health, when it was brought to our attention, we were putting money there, and it could be used for this purpose. It's exactly in line with what we are doing here money-wise and setting the priorities of the state of Oklahoma.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. When was the emergency clause added to the language that we're considering today?
Yesterday.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. And can you walk me through what that means for our consideration of this legislation today?
Thank you. If the emergency is not on the bill, and or if when we take a vote a little while, if it does not pass, the emergency does not pass, this language becomes effective and law 90 days from sine die, assuming the governor signs it. If this bill has the emergency clause and we're able to get 32 votes on the board for it, it goes into effect immediately upon the governor's signature.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. And so what does that mean for the more than 100 families that are currently on the caseload at this clinic? What will happen to those individuals?
It means that we are standing up for the values that we hold dear and believe that this is an inappropriate medical intervention at this point. The nearly 100 families that you mentioned, there's various levels from what I understand. Over the past 5 years, OU has not performed any surgeries, quote unquote, below the waist. They have done things like breast reduction and those type of things, puberty blockers, hormones. There's various levels of interventions they have done. I don't know the medical records of all, quote unquote, hundreds of families. I don't know the exact number to which you're referring.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. And so if this emergency passes and care is discontinued for these 100 families, what responsibility will the legislature assume in the increase in suicidality in our state?
I think that is a leading question that I don't wish to wade into those waters. We take mental health extremely seriously. Suicide is a issue that I take very seriously, that this body takes seriously, and that's the reason we're investing $39.4 million to provide much-needed children's behavioral health. If COVID exposed anything in this state, is that we're woefully underprepared on mental health, especially children's mental health, and we have an opportunity with this vote to change the trajectory of that in Oklahoma and actually get people who may be contemplating suicide or any other issue with mental health the treatment they so desperately need.
Senator Hicks, you are recognized for a follow-up.
Thank you, Mr. President. Are you aware with these exclusions that the individuals who will be directly impacted by our decision today are 4 times as likely to consider suicide?
I don't know the individual families that you're referring to with HIPAA. I don't actually know the families. If you're talking statistically, people who have these issues with gender dysphoria, I will not argue with your numbers, but us not using taxpayer monies to provide that is not causal. We must do everything we can. Every life has dignity and value, and at every turn we want to recognize that. Suicide is an awful, awful plague on different groups of veterans in our state, across our nation. We've got to show people that we care and we love, and one of the ways we do that is through investing in children's behavioral health.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. Can you clarify what taxpayer dollars are funding these services? I'm currently under the impression that these are private medical services that individuals pay for out of pocket.
Thank you for that question. The infrastructure, the equipment, the doctors' wages come at least partially from taxpayer dollars. And this, the ARPA dollars, are $1.87 billion, and you may say, well, those come from the federal government. The federal government is only funded by taking taxes from Oklahomans and people from all the other states and territories. So it is taxpayer funding that we do not wish to go to this. And honestly, the issue is much bigger than that. I alluded to it in the questioning earlier from another senator. This is addressing the issue we have you had at one area, but we will come back and address this in a more universal way at a later date.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. Are we experiencing currently a physician shortage and a nurse shortage and a healthcare shortage across the state?
Yes.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. What are the impacts of this legislation that we're considering today to the already shortage we are experiencing?
I don't believe this has any impact. We're investing in health care through medical records, through Stevenson Cancer, through OU Health, the 39.4, assuming this works, and the over 5,163,000 into the mobile dental units. So we are actually investing in health care, and bills that we voted on back in June invested heavily in workforce for nursing shortage, and we will continue that. I am proud of the work that the Joint Committee has done in addressing our critical medical needs, including workforce shortage. We will continue down that path.
Minority Leader Floyd, you're recognized for a question of the author on the Conference Committee report to Senate Bill 3.
Thank you, Mr. President. Mr. President, a comment was made a few minutes ago that the majority of Oklahomans disagree with this medical procedure. Can you tell me where you're getting that information and that data?
The myriad of constituents who've reached out to me and my colleagues, I have not done polling on it, but I know it's entirely consistent with what we are hearing from the public.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So the procedure that we're talking about, the medical procedure, is a procedure that has to be requested and approved by the parents since the children, to give consent for their children to have this treatment, do they not?
I believe that is correct at this particular facility we were talking about, yes.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So then you're saying that the majority of Oklahomans that disagree with this medical procedure disagree with parental choice?
No, I'm saying that there is sometimes a prevailing state interest in protecting people from life-altering decisions under the age of 18. We do that all the time. Tattoos, you cannot get parental consent to go get a tattoo. You cannot get parental consent to go to see an NC-17 movie, if those still exist. You can't enter into a contract. So there is a prevailing state interest in making sure that people, when they're not mature enough to make certain decisions, the state has stepped in throughout our history and made sure there are proper protections there. You can't buy alcohol until 21. You can't buy cigarettes until 21. You cannot do many things, and the state has found it in the interest of our society that we limit the ability in certain circumstances for people under the age of 18, even with parental consent, from making decisions that could negatively impact their life long term.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. But we're not limiting a minor's decision-making process. We are limiting the parents of a minor's decision-making process with this language. We are telling parents that they cannot have their children receive this treatment, are we not?
Same as tattoos, same as contracts, same as alcohol, same as cigarettes, yes. We are saying that this is such an important decision that you should reach the age of maturity to be able to make these types of decisions. In this bill, we're only dealing with UHAT in particular, but I think they're the major provider at this point.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So are you equating gender reassignment medical treatment with tattoos?
I am equating it with life-altering decisions, not the same level of acuity or anything like that. I am saying it's a life-altering decision that one chooses to do.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So why do you think the majority of Oklahomans don't support the gender reassignment medical treatments?
I think the majority of Oklahomans don't want taxpayer dollars going to a practice that they do not agree with. You've seen that in the past. In 2009, this legislative body passed I think it was 2009, it may have been prior to that, a prohibition on using state funding for abortion, prohibiting Medicaid dollars from going to that. And this is, I think, entirely consistent with that line of thinking.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. But we're not talking about abortion. I think many of us are aware of the majority of the people in the state and how they feel about that, because that issue's been around and it's been discussed. It's been discussed in public. It's been discussed in committees we have here. It's been discussed all over the state. I still don't understand why you are able to say that the majority of Oklahomans oppose this type of medical treatment for children.
I am very confident in that statement, even though I don't have polling to back that up. And I will grant you this is a much more recent conversation that Oklahomans and Americans have engaged in, human beings across the globe. But I remain confident in that statement.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So you made a comment earlier that immediately upon signature of this bill by the governor, all treatment for these children will stop. Is that correct?
No, the treatment will be much increased. Our ability to treat people with various different issues, with $39.4 million going to this building, no, treatment will not stop. Gender reassignment procedures will no longer go on upon the passage and signature of this bill if the emergency is adopted today.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So can you explain to us what the treatment is when you have gender reassignment medical treatment? Is that just a one-time treatment? Is it just a shot? Or is it a treatment that takes a process that takes more than days or weeks?
It would be a process in all situations, I believe.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So what happens if the treatment stopped midway through the process of the treatment?
I don't know the magnitude. Different individuals have told me different numbers on how many kids are actually going through this. I think the majority of the numbers are not some kind of surgical intervention. They're mainly puberty blockers, hormone treatment, and those type of things. And I think it's important when I say that there are exceptions in this bill for known medical conditions that require this treatment for things other than just desiring or believing that you should have a different gender.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So what medical professionals, doctors or other professionals have you visited with to get an understanding of what kind of treatment we're about to try to stop for these children?
I and my colleagues have visited with administrators and physicians from the institution we're talking about. I'm not saying we are taking their advice and putting it in law, but we have consulted with in drafting this language. I'm not saying that they are blessing the language in any way, shape, or form, but we have sought expertise from medical professionals because, as you know, I am not.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So what are the medical professionals telling you are the ramifications to these children if treatment is stopped before treatment is completed?
The conversations have more centered around what actually is happening rather than that specific question.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. Isn't it prudent upon us to find out exactly what the ramifications is to these children? If we care about these children and we're going to stop a treatment they're receiving mid-treatment, doesn't it behoove this body to find out exactly what the ramifications to that child are physically and emotionally and mentally?
I believe that many in this body believe the ramifications of the current medical protocol are damaging the children as well, and that's what this bill reflects.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. And on what evidence or information that we have from the medical community where does that belief come from that it's damaging to children? Because I haven't heard any medical evidence or discussion presented about why this is damaging to children. I've heard how it's offensive to some of the members of this body, how a parent's decision for their child is offensive to members of this body, but I haven't heard any information on how we know that these children will be okay if we discontinue treatment during the course of the treatment.
That's a much more particular question. I'm talking about the overall overarching issue of gender reassignment surgery and procedures when I make those comments. The particular of people who are midway through treatment, taxpayer dollars should not be going to something that I still believe, the majority of Oklahomans find objectionable.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President, and I'll agree with my colleague two desks down when I think the issue of whether this is tax dollars or not is up for debate. My main concern, and I wonder if the author joins me in this, is the fact that we are going to be circumventing parental rights and parental decisions they make for their child and their individual situation by legislation.
Sorry about that. I was not trying to cut you off. There are a multitude of examples where it is in the best interest of society that we limit decision-making until the age of majority. There are numerous examples throughout Oklahoma statute. I believe this is consistent with that. I appreciate your sentiment, but I believe this is entirely consistent with current state statute in limiting some major life decisions until one reaches the age of 18.
Further questions of the author. Senator Dom, you are recognized for a question of the author on the Conference Committee report to Senate Bill 3.
Thank you, Mr. President. My focus is not as much on the appropriations as it is on the other topic that we've been discussing about these procedures that are being done. I just want some clarity first before I have a line of questions. You had mentioned that many of us disagree with this practice. When you reference many of us disagree with this practice, what are you referencing? Because there's been references to the taxpayer money and or to the procedure. What exactly do you mean by many of us disagree with this practice, Mr. President?
Gender reassignment surgery and gender reassignment procedures, if that's through medication or otherwise.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. And so to clarify, are you saying the majority are opposed to that practice overall or solely for those under 18? Because that was a very broad statement, but this bill, I don't believe, deals with that broad of a topic.
You are correct. This bill does not deal with anyone over the age of 18. I think where I'm much more confident in my statement that the majority of Oklahomans agree, and I know the majority of our chamber agrees, deals with the minors. There are many, I assume, that would find it objectionable in adults, but all I'm talking about, both in this bill and commitments in the future, are about children making life-altering decisions.
Mr. Dom, you're recognized for a follow-up.
Thank you, Mr. President. Thank you for that question. And I fully agree with that. But my understanding is that this bill only prohibits those children from going through these procedures at this entity. Much has been said about the hundreds of families that have children currently going through this at this entity, at these facilities. Does this bill stop those children from going to a different entity here in the state of Oklahoma and continuing through those procedures that the majority of us find objectionable?
This bill does not. And I'm glad you brought up the hundreds. Hundreds is such a non-specific number. I've been trying to get my hands wrapped around, because there are some of these procedures that we acknowledge and still allow for that I'm sure are counted in those hundreds. But you are correct. This deals with UHAT, University of Oklahoma only, because this appropriation on this section deals with that only.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. So just to clarify, these children, other children, would be able to still go and get these procedures in other parts of the state, potentially even in other publicly funded, taxpayer-funded entities in the state of Oklahoma. Is that correct?
Conceptually, but I am not aware of another taxpayer-funded entity that is currently in this space. But I don't have an exhaustive knowledge. I think we need to really get the facts before we make a bigger leap on this issue. We're in agreement on the end goal, the timing of it. Yes, this bill does not end it elsewhere. I don't know if it's being performed elsewhere, but you may have facts that show it is.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. It was also mentioned about the taxpayer dollars, saying the majority don't want taxpayer dollars going to a practice they disagree with. As we've just established, there is the possibility that these children could go to another taxpayer-funded entity and still get this. Another entity could pick this up, even if we prohibit it here. But the mention was about taxpayer dollars, that people disagree with that. Are you saying that the majority disagree with taxpayer dollars going to these processes happening for minors, or happening at all in the state of Oklahoma using taxpayer dollars?
I think taxpayer dollars would be the entirety. I think as far as prohibiting the act, I think the majority of Oklahomans would want to prohibit it on minors that have not reached the age of majority. But as far as taxpayer dollars, I would believe the majority of Oklahomans, and again, I don't have data to back this up, but I would believe they would not want it used adults or children for taxpayer dollars.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. So with that in mind, does this bill prohibit taxpayer dollars from being used even by this entity to do gender reassignment, sex change surgeries for those 18 years and up?
I'm not aware if they're in that, but this specifically deals with children's behavioral health, and the exclusion specifically deals with those under 18.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. Yes, I'm aware that the language says that they cannot do it for children under 18. So does that not mean that this bill would still allow them to use taxpayer funds for 18-year-olds, 19-year-olds, and anyone of any age above that? Taxpayer funds still could be used for this process that that we agree the majority of Oklahomans would not agree with taxpayer funds being used for that?
I'm not aware of an adult program there. It may very well exist. The biggest focus has been on the children's side of things. Your statement is accurate if that is happening.
Senator Dom, you are recognized for a follow-up.
Thank you. And so I just want to clarify. So under this bill, UHAT or any of the entities within the trust could still continue to use these funds or any other taxpayer funds to do gender reassignment surgeries on 18-year-olds at taxpayer expense. Is that correct?
I'm not ready to say that is correct because you said continue, and I'm not sure if that's an ongoing practice.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. To rephrase, instead of using continue, under this bill, would the hospital trust or the authority or any of the facilities owned by them be able to use these funds or any other taxpayer funds to do gender reassignment, medical treatment, sex change surgeries on 18-year-olds?
I think if this body adopts an emergency on this bill today, we will send a loud and clear message to all publicly funded entities that this body finds that objectionable, and we plan to act very quickly. As far as legally, legalistically, technically, I think your statement is accurate, but I think adopting an emergency on this measure today sends a distinct, loud, unmistakable message to all taxpayer-funded facilities that the state of Oklahoma finds this objectionable. I think you'll see compliance quickly, and but technically, legalistically, if they are doing that, your statement is accurate.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. President. So technically and legally, could we not pass legislation to prohibit it so that no taxpayer dollars, even with this entity currently, could be going towards anyone having these surgeries, not just minors, not even discussing a statewide ban that we could do for taxpayer dollars or for minors, but could we not, in this legislation, have prohibited any taxpayer dollars from going towards those surgeries for any individual?
I don't believe we could have used Senate Bill 3 for that purpose. Senate Bill 3 appropriates ARPA dollars to various entities, one of which is children's behavioral health. I think it would have been non-germane to this bill. I think it would have been violative of numerous provisions of the Constitution. So no, this vehicle, I don't believe in its current state could have been used for that purpose.
Senator Dom, you're recognized for a follow-up.
Thank you, Mr. Chairman, Mr. President, for your indulgence. But in this bill, there currently is no prohibition on those taxpayer funds going to those 18-year-olds or being used on those 18-year-olds. But we could have put that in this bill to prohibit any of these taxpayer funds from going to that entity or any other entity for being used for those purposes that the majority of Oklahomans disagree with that practice. Is that not correct?
I don't believe that statement is accurate with this vehicle, because this vehicle does not deal with the entirety of health care. We have to deal with UHAT in this bill. And so I believe your statement is inaccurate. But today, if you vote this bill down, if you vote this measure down, you will be allowing it to continue on people under the age of 18, and that is clear.
Follow-up questions? Will there be further questions of the author on the conference committee report? Senator Kurt, you are recognized for a question of the author on the conference committee report to Senate Bill 3.
Thank you, Mr. President. Mr. President, is gender dysphoria in the Diagnostic Statistical Manual?
Thank you for that question. I will eagerly await you educating me on that because I have not read the entire diagnostic manual that you refer to, nor any parts of it other than what I've read in preparation for today. So Mr. President, I would yield to the senator who's asked me the question to let me know what's in there.
Senator Kurt, you're recognized for a follow-up question.
Thank you, Mr. President. Do physicians, psychologists, and psychiatrists work from shared standards of care that are updated as scientific knowledge is updated?
Yes.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. My understanding is that the DSM, the Diagnostic Statistical Manual, is the primary handbook for diagnosis based on medical evidence, and that gender dysphoria is in the DSM, which is only updated very rarely. It's every 5 to 7 years based on scientific evidence. If gender dysphoria is in the DSM, and on page 3 of this bill, we're disallowing medical therapies and medical interventions, what options will be available to physicians when they diagnose?
Oh, thank you. Thank you. I thought there was more to that. I apologize. This deals with UHAT exclusively at this point. So the merits or demerits of this bill, Senate Bill 3, deal only with physicians operating under the banner of OU at UHAT. So the question physicians implies physicians across the state. Senate Bill 3 exclusively deals with an appropriation, well, not exclusively, but the portion that deals with children's behavioral health deals exclusively with forbidding this act at that facility.
Senator Kurt, you're recognized for a follow-up question.
Thank you, Mr. President. So the Children's Behavioral Health Center that's being funded through this, in part through this bill, part of the medical health and treatment of adolescents could include the diagnosis of gender dysphoria. Is that accurate?
Yes, that is an accurate statement.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. So by including this language that limits medical care, what options will be available to physicians for caring for their patients?
I presume you're referring to just UHAT in that question. If you read down the bill, the same page you referred, page 3, the term that started on line 3, the term shall not include, so these are still allowable, behavioral health care services or mental health counseling, medications to treat depression and anxiety, or services provided to individuals born with ambiguous genitalia, incomplete genitalia, or both male and female anatomy, or biochemically verifiable disorder of sexual development, DSD, including but not limited to 46, XX DSD, 46, XY DSD, sex chromosomes DSD, XX, or XY sex reversal, and you can read on from there. So it's still allowed. These services specifically and on point to your question is what would still be allowed.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. Line 1 of that same page excludes medical therapies and medical interventions used to treat gender dysphoria. So what best practices will physicians be able to use if they're not allowed to do medical therapies or medical interventions?
Thank you for the question. Those delineated and the ones I just read off would what still be allowed going forward.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. What other medical treatments that might be based on new scientific evidence could be considered controversial in this facility?
I'm not going to enter a discussion in hypotheticals.
Senator Kurt, you're recognized for a follow-up.
Thank you, Mr. President. Since this bill specifically removes and limits a type of care, I need to understand if this is going to reduce the well-being of children who are being treated through our state-funded facilities. So are there other medical treatments that might be considered objectionable by this body that will be limited in this facility?
I cannot deal with every potential hypothetical that could be raised in the future. If that is the case, this body and the body across the rotunda would have to take that up in an open forum and have a discussion just as we are having today.
Senator Hicks, you're recognized for a question of the author on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. Is adolescent medicine a required rotation of a pediatric residency program?
I don't know all programs across the country, but I would assume that would be a requirement, yes. But that's an assumption on my part. I look forward to, if you have information confirming or denying that, I'm just going off of what I would think would be part of the regimen.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. It is a requirement of any pediatric residency program. And so how will losing that rotation by what we're doing today affect the OU Pediatrics residency program?
You won't lose that part of the rotation.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. As my colleague from Oklahoma City pointed out, we are removing that educational opportunity from all of our pediatric residents because this is in the DSM. It is recognized by the American Association of Pediatrics as best practices. And so how are we as a state going to continue to attract, retain, and recruit the very best pediatricians to our state when they are excluded from learning medical interventions that are life-saving?
The previous question implied that whole rotation would go away. That was what my answer was derived from. This is, I think, expressing the will of the state of Oklahoma and the voters who sent us here. I believe that it's entirely consistent with everything else we do in state statute to limit minors from making decisions that are largely irreversible or hard to reverse in the future.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. So where in the bill do I find that this is limited to life-altering and irreversible medical treatment?
We are talking about gender reassignment medical treatment, which by its very definition is life-altering.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. Is it also true that the majority of the services that are provided through this clinic are puberty blockers, which are reversible? And if that is also true, why is this language so broad that we are including reversible procedures?
Thank you for the question. I think based on your line of questioning, you must have more data on the specific patients that are going through this. I can neither confirm nor deny what you're saying to be true on the majority being on puberty blockers. Because of the privacy of medical records and other reasons, I've not been able to ascertain independently if what you're telling me is true. I have no reason to believe it is not true.
Senator Hicks, you're recognized for a follow-up.
Thank you, Mr. President. When considering this particular piece of legislation, many of my constituents have reached out. Therefore, I did my research and my homework to understand exactly what the impacts of this legislation would be on the folks that I represent. Through that research and discovery, over the past 4 years, there have only been 5 irreversible surgical procedures done in this facility. The 100 caseload that they're currently carrying concerns me greatly, and that those individuals are accessing medical treatment under best practices of nationally recognized institutions. And so again, I ask, Mr. President, in considering the broad language that is captured here, if the intent of this body is to exclude irreversible, life-altering procedures, why is that not reflected in the language?
Thank you for the question. I believe it is reflected in the language.
Further questions of the author. Senator Boren, you are recognized for a question of the author on the Conference Committee report to Senate Bill 3.
Thank you, Mr. Chair. It's likely that most Oklahomans have very little experience with a friend or family member who have needed treatment for gender dysphoria. Wouldn't you say that that's a true assessment of Oklahomans' experience with this topic?
I would assume that to be correct.
Senator Boren, you're recognized for a follow-up.
Thank you. So I need to know then, how are Oklahomans informing themselves around the proper treatment of gender dysphoria if they have very little personal experience with the subject matter?
I think that this body is elected to make decisions both easy and hard, and I know this is a very difficult issue for many people. It's not one that I look forward to, just excited, but it's important that we provide this children's behavioral health, and I think we lose sight oftentimes that we're about to invest another $39.4 million in helping the very kids that some purport that we're damaging. This is your question about, do they have the expertise, have they had the relationships, have they had the personal experiences? I agree with what you're saying, that most people probably have not experienced this or had a loved one or a friend, and I'm sympathetic to that, but I do believe this is entirely reflective of where Oklahomans want us to be on this issue.
Senator Boren, you're recognized for a follow-up.
Thank you, Mr. President. So I agree with you that Oklahomans are probably uninformed on this topic. And there are times on topics that, as leaders, then we have to step forward and lead in that space. So can you explain to me how this body has become informed on this topic, other than YouTube or cable news? Have we done any interim studies on this topic?
Thank you for the question. I disagree that Oklahomans are uninformed. I think we have an informed populace, so I will disagree with the premise of the question. However, I don't watch TV, so I didn't get my information from TV. My kids watch YouTube. I don't watch YouTube. I've been reading all I can. I've been visiting with people face-to-face, talking to people. My research is not done by turning on the TV, by going to a website, or by watching YouTube.
Senator Boren, you're recognized for a follow-up.
Thank you, Mr. President, but I understand that your research did not include a review of the DSM standards. Is that correct?
It included a cursory glance. I would never purport to be a medical expert, nor have I ever made that insinuation on many issues that we deal with as legislators. We have to take the information presented to us, research it to the best of our abilities, and make as informed a decision as we can, and I believe we are making an informed decision on this vote. If the emergency of this bill passes, this practice will end at that facility upon the governor's signature.
Senator Boren, you're recognized for a follow-up question.
Thank you, Mr. President. So your research also didn't include the pediatric rotation and how this bill will impact certification, how it impacts the training of pediatricians in Oklahoma. Isn't that an accurate statement?
It is an accurate statement that I did not read through every medical school's protocol, that is accurate.
Further questions of the author. Senator Brooks, you are recognized for a question of the author on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. And so going way back, because I know you've been answering a lot, or I know that the author has been answering several questions. But when we were talking about the increase of suicidal ideations and attempts, the author talked about every life having dignity. And so is that his belief?
Yes.
Senator Brooks, you're recognized for a follow-up.
Thank you, Mr. President. And so it's not the majority's lives that have dignity. Is that correct?
That is absolutely correct.
Senator Brooks, you're recognized for a follow-up.
So what about the dignity of the children and parents who are struggling with gender dysphoria? What about their dignity?
This bill recognizes that really does happen, and that's the reason you see the exclusions. That's probably a bad word, but the exclusions to the exclusions, or the allowances, on page 3 that I was referencing earlier to our colleague from Oklahoma City.
Senator Brooks, you're recognized for a follow-up.
Thank you, Mr. President. So me personally, as a parent, if I have a child with a medical condition and there is medically accepted forms of treatment, and we're precluded from having those in Oklahoma, especially when they result in increased ideations and attempts of suicide, is that a good thing or a bad thing?
Your question leading up to your question, or your statement leading up to your question, is inaccurate. This bill, if adopted, stops it at UHAT, the procedure at UHAT, OU. It does not stop at statewide, although there's a desire many of us in this body have to expand that later on. The question, is that a good thing or a bad thing? There are reasonable, recognized, long-standing restrictions on minors' ability to make decisions before the age of maturity.
Follow up.
Senator Brooks, you're recognized for a follow-up.
So for those children, is it more appropriate that the majority make that decision when we haven't polled it and we don't know it's really the majority or just a vocal minority? Or would it be more appropriate for parents to make those decisions?
Thank you for that question. I believe there is a state interest in making sure that people who make these decisions at the age of maturity.
Senator Brooks, you're recognized for a follow-up.
So is the author saying that those state interests trump individual parents and patients, their interests?
I think that if the questioner believes that a minor should not be able to get tobacco even with parental consent at 21, a minor shall not be able to get a tattoo even with parental consent at 18, a minor cannot enter into a contract even with parental consent, then yes, I think there are prevailing state interests to protect the interest of children who are not at an age of maturity to make informed decisions, sometimes even about themselves.
Senator Brooks, you're recognized for a follow-up.
And so the author mentioned some other things that I think aren't prescribed by doctors or not recommended by medical journals. Does he have another one where he wants to restrict parents' ability to be able to make well-respected medical decisions on behalf of their children and only with their children's consent?
This bill doesn't deal with any other. This author has not sought that, nor do I have any plans to seek any other issues that the questioner refers to.
Senator Brooks, you're recognized for a follow-up.
Thank you, Mr. President. And so we've established that every life has dignity. And so what effect does this treatment have on anyone who is not a child or family member dealing with gender dysphoria? What practical or direct effect does it have to any other person?
Thank you for that question. I think if taxpayers are funding a practice that they find questionable at best and morally objectionable at worst, they have a lot of stake in this, that they're using taxpayer dollars to perform a procedure that they find violates their moral code and their belief of what is appropriate.
Further questions? Minority Leader Floyd, you're recognized for a question of the author on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. Mr. President, do you agree that gender dysphoria is a medical condition?
Thank you for that question. Like I said, I'm not a medical expert, never have claimed to be. I have issues with the prevalence. As of late, I have issue with the amount of attention that it has received. My children, as you know, are 14, 12, and 11, and this is a daily confrontation of issues on this particular set of issues. Is gender dysphoria recognized in medical journals? Absolutely. I know that to be true. Is it as prevalent as society currently believes it is? I don't know on that.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. Well, if we know that it is in fact a medical condition and we don't know how prevalent it is, then why would we stop those who need a medical condition and treatment for a medical condition? Why would we stop those people from being able to obtain treatment for a medical condition?
Because they have not reached the age of maturity, which I believe they can make a decision capable of making that big of a decision. Plus, I know I've said this a few times, I don't want to just be disagreeable, but I do disagree with the premise of the question. We're not denying health care, because if you look at those acceptable practices, we are still recognizing that people need help, they deserve help, and we are allowing for that and making sure we codify that in this bill.
Minority Leader Floyd, you're recognized for a follow-up question.
Thank you, Mr. President. And Mr. President, you keep saying that we need to wait for the child to be 18 to make those decisions, but the parents are actually the ones making the decision for the children. And that's not unusual for parents to make medical decisions for their children, is it?
No, it's not. No.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. And so there's been discussion about parents making medical decisions for their children and treatments that involve taxpayer dollars. So is it the plan of this legislature that we are going to start checking all medical procedures that are paid for by taxpayers and then decide what procedures we believe are objectable and take those away from the options that parents have for their children by passing legislation much like we're doing right now?
I don't think this body has shown a history that we insert ourselves often, but there are certain things that rise to a level such as this that we're dealing with now, and taking the life of an unborn baby. We had already restricted using taxpayer dollars for that, not using public funds for that anyway, over a decade, maybe 2 decades ago. So I think we have a history of being cautious in entering that, but when we do, it's for an extremely important purpose such as this.
Minority Leader Floyd, you're recognized for a follow-up.
Thank you, Mr. President. So then it is our intent to move forward going through medical procedure after medical procedure that we deem improper or we philosophically disagree with, and as a legislature start passing bills to restrict those procedures and parents' ability to choose the procedure that's best for their child.
No.
Further questions? Senator David, you are recognized for a question of the author on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. Mr. Pro Tem, would it surprise you to know that there are actually medical professions professionals who are leading transgender medical professionals. One's a leading surgeon, and one is a psychologist from the University of California. They're both transgender women. Would it surprise you to know that they have some real concerns about giving puberty blockers and doing surgeries to children under the age of 18?
Thank you for that question. No, that would not surprise me. I appreciate you bringing that up. I have read medical professionals that take that, not the two that you referred to. I appreciate you bringing that up.
Senator David, you are recognized for a follow-up.
Thank you, Mr. President. And a lot has been said, Mr. President, on this floor that we're doing irreparable harm to these children who have this medical condition. And does this bill in any way say that they cannot receive the mental health that they need to ensure that they're in the right place mentally when they receive this surgery?
Not only does it not deny it, it puts $39.4 million toward that and codifies what is allowable. So no, it absolutely does not deny that. It codifies the right to be able to get those much needed mental health treatments, and we put $39.4 million to complete an investment we've already started in Oklahoma.
Senator David, you are recognized for a follow-up.
Thank you, Mr. President. And would it surprise you to know that these two leading doctors who do this surgery and treat these kids on a day in and day out basis are more concerned about ensuring that their mental health is where it needs to be, but they're also concerned about puberty blockers at too young of an age, leading to sexual dysfunction when these children become adults?
Thank you for that. I have read about that and have found that compelling as well.
Senator David, you're recognized for a follow-up.
Thank you, Mr. President. And I'm going to pivot here for just a second because the mental health part of this bill is so important, Mr. President. Mr. President, are you aware of what happened in Tulsa a few days ago with the Tulsa DA?
Mr. President, I was distracting trying to get an actual number on the budget, and I apologize to the gentlewoman from Porter. If she could repeat that question, I do apologize.
Senator David, you are recognized to repeat or restate your question.
Thank you, Mr. President. Mr. President, are you aware, I'm pivoting back to the bill as a mental health bill. Are you aware of what happened a few days ago to the Tulsa DA?
Yes, I have read about that.
Senator David, you're recognized for a follow-up.
So, Mr. President, the much-needed mental health that this bill will provide, do you believe that will help prevent what happened to not only to the Tulsa DA, but happens to parents day in and day out when their kids are not able to get mental health that they need, or we're not able to find a mental health bed, and we put them out on the street where people die, they are killed. They're killed because people don't know how to deal with them. They're killed in severe accidents because they harm themselves. Will this bill help with the mental health crisis that's currently going on today?
Yes, we are making strategic investments, historic investments, generational investments in the mental health needs of our children and adults through the use of this ARPA money and state money, and we will continue that. Thank you for that question.
Will there be further questions of the author on the Conference Committee report to Senate Bill 3? Senator Hicks, you are recognized for a question of the author.
Thank you, Mr. President. And so in line with irreversible and life-altering procedures that require parental consent and actually no consent by the minor, are we also including circumcision in this particular measure?
No.
Further questions? Seeing no further questions, Pro Tem Treat ask adoption of the conference. No, sorry. As to adoption for the conference committee report, will there be debate? Senator Boren, you're recognized for debate.
Thank you, Mr. President. First of all, I'm very grateful for those in Oklahoma who are working to provide medical care, for those at risk of being excommunicated from Oklahoma's families, Oklahoma's schools, Oklahoma's churches and workplaces, for providing medical care to those that are at risk of dying by suicide and who are at risk of homelessness. Thank you for your dedication. Thank you for your dedication to modern medicine, for research, for learning and getting better. I'm grateful for your dedication to the well-being of everyone. And I'm very sorry that you're being tormented and targeted by those who abuse their religious authority in Oklahoma. My faith has provided me great comfort and has carried me through so many things. And every day I get to see and witness how my faith is weaponized against people who are trying to provide care to some of the most marginalized people in our state. This bill accomplishes good goals, which were accurately outlined by the author. But in Oklahoma, you always have to pay a bigot tax whenever we do something progressive. In this bill is embedded an agenda of bigotry, and it will continue to bear toxic fruit. We've already heard it. We've already seen. Today, it's curtailing medical care, modern medicine. Tomorrow, it's criminalizing. We have already been through this, and our trust is minimal. There is no reason to trust that this is the end of the matter. First, I want to define what I mean by bigotry. I think it's confusing for somebody. Sometimes it's treated like a slur, that anything somebody doesn't like, we just call them a bigot and move on. Bigotry manipulates political power and public resources to maintain dominance and demand assimilation into the bigot's culture or religion. We saw that during the Civil Rights Movement. That's what bigotry was. It was exploiting political power and cultural power to exert dominance. The other thing that bigotry does is it dehumanizes people who cannot and will not assimilate into the bigot's demands. Dehumanizing other people is a core tenet of bigotry. Now I want to compare that to redemptive faith, and I apologize. I know that a lot of us like to keep broad margins between public policy and religion, but I think in Oklahoma we always have to deal with it, especially when you have a culture that is so prone to abuse religious authority. So I'm going to go there. Redemptive faith always sees our neighbors as image bearers and refuses to dehumanize others by defamation and slander. Somebody that's motivated by redemptive faith, if they see somebody across the room, or if they see somebody across the chamber who is seen as who is a threat, who is a political, cultural threat, redemptive faith always sees them as a neighbor, as somebody that bears the image of our Creator, and refuses to dehumanize, refuses to call names. And that's really hard. It's really hard not to dehumanize one another. That is essentially what is going on in America right now, is we are so easy to just label and brand people as groomers, as predators, as pedophiles, as godless, as woke, as liberal, as communist, as Marxist. All of that dehumanizes each other. And a redemptive faith restrains ourselves from doing that. And I confess to you all, I mess up on that every day. And it violates my values, it violates my faith, it violates my principles. And it does make me feel good at first, but the damage it caused has caused damage throughout human history when we dehumanize other people. And you're going to hear that. It's not going to be probably 20 minutes after this bill passes. The dehumanizing of Oklahomans is going to be front and center, and lots of money will be raised, and lots of power will be preserved in doing that. This bill ignores and disrupts Oklahoma's access to health care and modern medicine to advance a bigoted agenda. By accommodating bigotry in incremental and tailored ways, we are undermining the health of all Oklahomans. Right now, there are people just entering medical school. There are people that are deciding which residency that they want to go to. They're deciding where they want to spend their life as a healthcare provider. Bigotry as an economic system is unsustainable. It undermines our economic security, it undermines our cultural security, it undermines our health care. You cannot find a government, a culture of people anywhere on the planet that is advancing and taking advantage of innovation, creativity, who is dedicated to a bigoted economy, who is dedicated and funds bigotry. You cannot find a successful group of people who put their money in the bucket of bigotry. Bigotry does not redeem a culture. It kills, steals, and destroys culture. And it will continue to do that in Oklahoma's culture. It will continue to undermine our economic security. It will continue to undermine our innovation. It'll continue to undermine our creativity until we have enough people empowered who are devoted to the good of one another and who are refusing to fall into the profit of dehumanizing each other. We will be able to reach our fullest potential when we are committed and fund a system that recognizes that every Oklahoman is worthy of belonging and grace and access to the resources they need to figure out life in the best way possible.
Senator Kurt, you're recognized for debate on the conference committee report for Senate Bill 3.
Thank you, Mr. President. I first want to express my deep disappointment that the American Rescue Plan legislative process has been undermined in this way. We've spent a year and a half working hard to prepare to try to actually address the needs of Oklahomans in meaningful ways, to use these funds in a way that can move our state forward and can address some of the biggest needs and challenges in our state. We've spent a lot of time to get where we are. Do I agree with every decision? No, I do not. However, this undermines that. This undermines the integrity of the Senate in terms of our process. To be adding something so specifically policy-driven into this process is deeply disappointing. So I just want to say first, I voted for all of these projects in committee 2 times. I spent a lot of time analyzing the healthcare needs with very able committee members and chairmen of the state and how these funds could be best applied. This bill does not have anything to do with those decisions and those needs we were looking at. So I'm deeply disappointed with this bill as presented and in undermining behavioral health care, dental health care for rural Oklahomans. It's not just putting one pot of money on at risk. It's putting the entire opportunity that's presented in this bill at risk. It's putting cancer care, expanded cancer care at risk. It undermines both our process and our priorities. Secondly, I want to say that Oklahomans, and specifically young Oklahomans who are transgender, live among us. They're our neighbors. They might be family. We may not know who around us is transgender. They deserve respect, dignity, and medical care that serves them with best practices.
Senator Hicks, you are recognized for debate.
Thank you, Mr. President. The reason we're here today is to appropriate American Rescue Plan Act dollars. That was the call to our second special session. The reason we find ourselves in this conversation is that the majority was unwilling to separate two very distinct conversations, one involving policy and one involving appropriations. It is no secret that our caucus remains strong in supporting expanded access to behavioral health services in this state, a priority that we have been consistent in elevating the need and in our voting records to make sure that mental health treatment services are readily available in every corner of the state. So it is deeply troubling that this vote is now wrapped in a policy conversation that is an all-out culture war. The conversations today involving foolhardy, reprehensible, these descriptions of recommended best practices for medical care are incredibly disturbing. And so to the constituents who have reached out, I apologize for the lack of decorum that this body is taking in a very personal conversation involving your well-being and your access to treatment in our state. I've spent my life working in suicide prevention spaces. I lost one of my dear friends in high school to suicide. And so for those of you who are listening, I want to elevate one resource called the Trevor Project, because we know that when any anti-trans legislation is introduced, there's an 85% increase in suicidality in our communities. Please reach out for help. You are seen, you are valued, you are represented by a senator that loves you and wants to see you mature into adulthood. Please do not let these conversations define your worth and the value that you bring to our communities.
Members, as a general reminder, I would like to point each of our senators to Senate Rule 8-30-B. No senator in debate shall directly or indirectly by any form or words impute to another senator or to other senators any conduct or motive unworthy of becoming a senator, as well as our rules on the floor 5-5C. On the floor during session and committee, members should endeavor to be congenial and complimentary. Members should avoid personal attacks and dealing in personalities. Senator Merrick, you are recognized for debate.
Thank you, Mr. President. I appreciate all of the questions and debate related to this topic of what we should do here in Oklahoma concerning this sensitive issue of gender dysphoria and what we should do and how we should respond to what the DSM labels as a mental disorder. I believe it is a very serious issue we're seeing across our nation, and we should respond appropriately. I share the sentiments of my colleagues, the majority of the colleagues in this body, that to promote and help facilitate with taxpayer money the gender reassignment should be disallowed in this state. I think it reflects the majority of the opinions and values held in this state. And so I think that that action should be taken and taken swiftly. But I believe this discussion concerning this issue is founded on a false assumption that the way we accomplish this is by accepting federal money. I think that what is consistent with what I believe is the failed administration in the White House is a tendency to label certain things the opposite of what they actually are. The Inflation Reduction Act is exactly the opposite of that, and it helps facilitate and increase inflation. And the American Rescue Plan is exactly the opposite. This train called ARPA is taking our country more quickly over the cliff. And I believe that to accept any of these funds is to just throw more coal, more fuel on the fire, and help us accelerate more quickly over this cliff. So I'm opposed to accepting any federal funds in Oklahoma. I think we need to put a return to sender stamp on this check and send it back to Washington and say, we'll figure it out here in Oklahoma, but we're not going to add to the $30+ trillion of debt. Forbes magazine said over the next 10 years, we're expected to pay over $5 trillion of interest on our national debt. I personally when I ran for Congress a few years ago, said that I would love to set a budget to reduce our national debt. I believe it's a very significant issue in this country, and we as Oklahoma have an opportunity to say something about it and do something about it by rejecting this money, sending it back, not just taking everything that's offered to us with all of the strings and all of the hooks. Every single one of these projects we're going to vote on can be justified with good causes, with heartfelt emotion. But it doesn't make it right, and it doesn't serve the greater good of doing our part to save this country and emphasize our state sovereignty in the meantime. So I believe we need to have this conversation, and we need to have it again very quickly. I would ask that we call for another immediate special session to deal with this specific issue, to end this practice in Oklahoma, but not do it based on accepting federal money. Just simply as the legislative body representing Oklahoma to decide what will be allowed in this state and what will not be allowed. I find it very interesting that we are interjecting ourselves into this conversation about what hospitals can and cannot do. But a few months ago, we said, no, we cannot. We must stay out of this conversation about what hospitals can and cannot do concerning vaccinations. I believe that if any entity receives taxpayer money, then the legislative body has a right and a responsibility to speak to that entity and to offer direction. So I believe we do have a right and a responsibility to speak to facilities receiving taxpayer funds and saying there are certain things that we will allow and we will not allow. If you don't like it, reject taxpayer money and become fully private. But as long as you receive taxpayer money, we as the legislative body have a responsibility to offer direction and make certain requirements. So I would encourage this body to be consistent. And if you ran on reducing the size of government, to not grow government, then let's do just that. Let's stop growing government. Let's stop spending all of the money that's offered to us. We don't have to take it just because it's offered. There is a better way. I say we take the higher ground as a conservative state and take the conservative way. I will be voting no on this one for that reason and all of the other ARPA funding bills, because I reject the premise that it's okay to go ahead and increase the national debt and jeopardize this country even more. So at the same time, I do believe this particular issue is important and it must be addressed, and it must be addressed immediately. So I believe we do need another special session to do just that.
Senator Young, you're recognized for debate.
Thank you, Mr. President. I rise first off because the special session was called for appropriations. That's literally what I was told. That's literally what was given to me, that we were going to approve the appropriations because the governor had screwed up and the legislature took it from the governor so that we could get the monies out. And now we're dealing with policy. Normally, during the regular session, we have policy. You have time to go through a committee. You have time to discuss it in committee. You have time to look at it in committee before it comes to the floor, and you can talk about policy then. I've had a couple of days to even think about this policy change, Mr. President, that is very serious, and it impacts so many people in this state. I came prepared to vote on end of last May, end of last session. We went 70, 80 bills, and just like it was speed dating. We were going through them like you know, just call a number. We didn't even have names of the organizations that the money was going to, and we were appropriating those funds to them rapidly. And now we come and we're spent almost a half a day because we're doing what we're not supposed to be doing. We're dealing with policy issues. I hope that the citizens of Oklahoma are checking in and looking in and seeing we're trying to sneak something in on them that now they don't even have an opportunity to make any comment on. And so I appreciate the work that my colleagues have done, particularly those who were on the ARPA plan committee and came back and told us that they were appreciating the things that the money was going out for. This is not one of those times for us to start using this platform to push policy issues that we think are good and great. Secondly, I was a chaplain for 15, 20 years over at St. Anthony's Hospital and Mercy Hospital. Every time there was an issue with a minor, the parent was called in and said, we cannot do anything until you decide what's best for your child. Now all of a sudden, we want to make decisions above the ability of parents who live, who feed, who nurture their children. We want to make those decisions for them. And then lastly, I was in Bible study last night, and it struck me, one of the members said to me, why are you guys in special session? And what I described to them was very similar to what we are going through right now. I said, I really don't know why we're in session either, because all we had to do was to have a special session and approve the appropriations to be done. But I told them, I described what I thought would happen today, and I wish you could talk to some of those members now, and you would think that I'm a prophet, because this is exactly what I described to them. Then lastly, I'm hurt. Dr. Marnie over at OU Health Science Center, who is one of the physicians with Children's Hospital, I call her one of my children because I appreciate the work that she does. I'm going to have to stop and apologize to her for this body interfering with the work that she does as if we have medical background. And we've said it all day today. We are not abreast of the medical records, medical information that we need to make the policy decisions that we are making now. I wish we could have just had the appropriations. That would have been fine. We're taking the words of those who were on the ARPA committee and saying that what we had done is good and just and to get that money out to help Oklahomans. Instead, we are trying to push agendas. Thank you, Mr. President.
Senator Hamilton, you're recognized for debate on the conference committee report for Senate Bill 3.
Thank you, Mr. President. I want to commend the gentleman from Senate District 22 for the incredibly relevant points that he brought up in the debate today. And I also find myself in the infrequent position of commending the gentleman from Edmond for his extremely relevant points that he brought up in his presentation today as well. There is a lot of wisdom in what he has to say. However, he is a human being. He's a man. He's fallible, just like all of us are. Like even King Solomon, who's the wisest man who ever lived, made mistakes. All of us in this body can make mistakes. Each of us can make mistakes. And so my hang-up with this plan is not so much in the spirit of the law or the plan, as it were, but in the letter of it. And here's what I mean. I'll talk about three things, and we'll start with sequencing. When you make a cake, you're going to put the thing in the oven, and you're going to put raw eggs in it. But there's a sequence to that. If you put the raw eggs into it after it comes out of the oven, you end up with a mess. So the eggs have to go into it before it goes into the oven. The correct sequence of events on this particular issue is to institute a ban, a statewide ban, which the gentleman from Edmond has already expressed his support for. And the reason I say that is that I don't trust OU or the OU Children's Hospital. And the reason I don't trust them is because you're dealing with an entity that saw fit to use the money that they were entrusted to be stewards of to stand up the Roy G. Biv Center for Behavioral Health, which would be more correctly termed children's genital mutilation.
Members in the gallery, you are prohibited from expressing approval or disapproval through outbursts. This is warning number 1. Continue, Senator Hamilton.
Thank you, Mr. President. We're presented with what I believe to be the false dilemma that if we do not approve this bill, that children's mental health is going to be severely and adversely impacted. And my question is this. I don't deny that it's an issue, but if it is such an issue that OU Children's Hospital places such importance on, then why was the money used that stood up the Roy G. Biv Institute not used for these other things that we are making provisions for with the ARPA money? Is this a requirement for government to fund? My conclusion that it is not comes from several institutions. First of all, the Shriners Hospital for Children. Those are nationwide, and I'm not aware that they receive any ARPA funds. We also have St. Jude's nationwide. How much ARPA money is St. Jude's receiving? Back on the idea that I don't trust those in positions of stewardship at the OU Children's Hospital, I will say this. What we're doing here is voting to turn over roughly $100 million to the same people that saw fit to stand up this mechanism in the first place. Now, to me, that is akin to asking Bernie Madoff to manage your 401k, and it's not very smart. The same people that are running this program now are the same people who are going to be in charge of this money in the future. And either they were negligent and they disagree with these procedures, or they were complicit. Not sure which one, but whichever one it is, either or both, it's unacceptable for us to then be trusting of somebody who's demonstrated such a lack of stewardship, to then trust them with $100 million of we the people's money. We also, and finally I'll close with this idea of guardrails, safeguards, and so on and so forth. I believe that those things are well-intentioned, but I will offer this for consideration. 1919, Treaty of Versailles was signed. Governments of Great Britain and France had it as their avowed purpose to crush Germany, and had guardrails, safeguards, and procedures in place to ensure that Germany was never able to become, again, the militaristic nation that started World War I. 1925, Adolf Hitler published his manifesto and told the world what he was about. A few short years later, the Holocaust was well on its way. And so, by using this example, I'm sure somebody will say that I'm equating the OU Children's Hospital with Nazi Germany. No. I'm simply making the comparison of an organization that in place guardrails and safeguards, and by 1941 had realized that those guardrails, those safeguards, those procedures that they'd put in place to prevent the unthinkable from happening had failed. And so my concern is that we will in place safeguards to do the things that we want to happen, and that this entity, being OU Children's Hospital and Oklahoma University, which has a history of thumbing their nose at this body under the rotunda, will do just that, and we'll find ourselves in a position of having done what they wanted and not what the people of Oklahoma want. So I'll vote no on this for those reasons, and urge you very seriously to consider these as well. Thank you.
Senator Jett, you are recognized for debate on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. Members, we've had a number of postures taken on this particular issue, but it all comes down to money. And Scripture says that the love of money is the root of evil. And the moment we start threatening money, we start getting the undivided attention of the bureaucrats or agencies that want to gobble up and consume that money. And we represent our taxpayers back home, our constituents, who provide that money or have to pay back national debt. So I want to talk a little bit about the economics of this. First of all, as I understand it, Mr. President, this money doesn't have to be earmarked or assigned for another 2 years. This is the end of 2020 and 2024. It has to be earmarked or assigned. And it doesn't have to be spent until 2026, 3 years from now. So one of the economic measures that I think we should take in consideration, and I'm debating against this bill for a multitude of reasons, but one of them is the Federal Reserve is looking at raising interest rates because our economy is in inflation due to policies of the current administration, due to a number of economic issues, one of which is washing the United States with the tremendous amount of funds that not only is adding to the inflation, but is also going to cause state government to grow. And here's, those of you who have owned businesses, those of you who have owned buildings, you understand that just building a business or just building a physical building, it comes with utility bills that follow, plumbing bills, maintenance that has to be done, keeping the lights on, all of these things that goes into it. So when we start putting money into institutions with one-time money from Washington, D.C., we are also encumbering our taxpayers with the upkeep and use of those buildings. So we are, in fact, growing government. But here's the other issue that has to be taken into consideration. By adding this money to the current overheated economic context, we are contributing, as the senator from Edmond pointed out, we're contributing to that continued inflation. Prudence would say we wait for 2 years. The economic forecast is that a recession is coming. Anyone who's taken macroeconomics at a university level will understand that you can't flood the economy with cash without it affecting prices and causing inflation. If we hold off on spending this money for a year, 2 years, plywood will go down, concrete will go down, in reflection to the recession that's coming, and you would have more bang for your buck. You would have more beds that you'd be able to invest in if this is the direction the people of Oklahoma and their representatives here on this floor and across the Capitol Rotunda wish to do. By spending it today, we're going to get less bang for our buck because we still have supply chain disruptions. It is hard to get plywood, hard to get concrete, hard to get paving. All the infrastructure that's needed is more expensive because supply chain disruption as a result of the COVID shutdowns. By holding off on spending the money, we will get more bang for our buck. Now, we raised the question, it was brought to our attention that the University of Oklahoma Children's Health, who we all have wonderful stories from our constituents who have gotten tremendous help when their children's been there. My wife has been there when we had issues with our firstborn, Raquel. Wonderful institution. But again, this is about money. And I couldn't be more profoundly disappointed in the administration and leadership who stood up the Roy G. Biv. This was layered in intentionally. Roy G. Biv stands for the colors of the rainbow. This didn't just happen overnight. This was layered in. This was strategic. It stands for red, orange, yellow, green, blue, indigo, violet. It's not a person, it's a color. And it's a color that was intended to have a political message. Because political science is being followed in this context, not medical science. I taught at St. Gregory's University in Shawnee, Oklahoma, world geography and culture. And one of the things we discussed in that college class was female genital mutilation, FGM. The blinding of young girls across the African continent and other places in the world. And what a terrible thing that was. And we're not talking about those who are in gender dysphoria who are adults. We're talking about children at Children's Hospital where they can't get a tattoo, as the president of the Senate pointed out. They can't get tobacco or alcohol, even with parental consent. In fact, we have laws in place that if you mutilate your child, you will lose your child. Because there are standards of decency that we do not permit in good conscience. And if you saw it, I'm certain that you did, the University of Vanderbilt very crassly and very directly, and I appreciate their transparency, pointed out that gender reaffirming surgery is a cash cow. Ladies and gentlemen, the reason why the University of Oklahoma Children's Center stood up Roy G. Biv wasn't because they were protecting children, it's because they were going after the money train. Because whenever you do these surgeries and try to convince a body that was born a boy or a body that was born a girl to change in defiance And this is not assignment of gender at birth. This was assigned by God Almighty, and we're tiptoeing around that. And when you wound a body, it will continue to try to heal itself. And that's why the University of Vanderbilt saying this is a cash cow, because they know the moment they step across that line, there will be additional surgeries, and additional treatments, additional hormones, additional chemicals. At what point did we decide that a child and a parent who decides that their child needs to literally do surgery on their body because they have dysphoria, a sense of anxiety? Is it a mental health issue? Of course it is. Everyone's been dissatisfied at some point in their life with aspects of their life. But is chemicals and steel the way to solve this? It's all about the money. They stood this up at Oklahoma Children's because they got the eye off the ball, the interest of the child, and they looked for the interest of the checkbook. They're taking advantage of children and families that are in crises and monopolizing it and creating cash opportunities for themselves. If you don't believe me, take a look at the article by the Associated Press that just came out. OU Health ceasing some gender care after funds threatened. Imagine what they would do if we get their undivided attention and do not give them the funds. It's going to overheat the economy, create additional tax burden on taxpayers going forward until they clean up this mess. A time of the essence, I would say that spending this money today is bad economic planning. 3 months from now, we'll be in regular session where we can put actual policies on place to protect children. And if we need to, yes, children from parents who would allow them to be mutilated. Remember, we also say parents aren't allowed to kill their babies in the womb. Last legislative session, I had to point out time and time again that these aren't protected medical procedures. They were killing babies in the womb. And they talk about gender dysphoria as a medical condition. But the conclusion is get them on a train of surgeries, chemicals, medications for the rest of their life. And also blinds them sexually and prevents them from reproducing. We need to send a very clear message, not that we're threatening their funding, but they're pulling their funding until they get their act together and start focusing on taking care of children instead of taking advantage of children, just like the medical community and the insurance companies figured out that there was a tremendous gravy train of revenue opportunities by funding and codifying transgender surgeries to take advantage of American citizens in crises. Let's call it what it is. Economically, this is bad. It's more prudent if we wait to spend this money whenever the economy has simmered down. But while we've got their undivided attention, let's send them a very strong message until they clean up their act. We're withholding this money until further notice. I urge you to vote against this bill for the reasons I've outlined.
Minority Leader Floyd, you are recognized for debate on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. Members, I'm sure you could tell from the questions I asked earlier that I have concerns about this bill. First, I'm concerned that we are making major changes to policy. Major changes to policies without going through the usual 4-month legislative process, where we have public input, we have debate, we have committees. It concerns me when we make these types of changes without following the legislative process. I'm concerned that we're adding language to this bill that puts restrictions on how behavioral health care is going to be administered to our children. Restrictions on how doctors can practice best medicine. I have concerns that the bill not only puts restrictions on how doctors can practice best medicine, but it actually dictates to our medical providers how they practice medicine. It doesn't take into consideration best practices. It doesn't care about the doctor's experience or education. And just as concerning, not only does this bill take the decision-making process away from healthcare providers and medical professionals, this bill, more importantly, takes away parental rights. The rights of parents to make the decisions regarding what's best for their children. And it's curious to me why this is different than other healthcare decisions that we assume and support parents to make. Why is this different from all of the other healthcare decisions that we've seen over the last few years that parents were making for their children? Healthcare decisions regarding wearing masks, healthcare decisions regarding vaccines. Why is this different? The fact of the matter is that this is an incredibly complex issue. Physiologically, psychologically, medically, this is a complex issue and not one we can solve with a few hours of debate. But one thing that's not complex to me is that this is a basic parental right. And that's what we're talking about here. The rights of parents to be able to determine what's best for their children.
Further debate. Senator Dom, you are recognized for debate on the Conference Committee report for Senate Bill 3.
Thank you, Mr. President. First of all, let me start off by saying I can understand why there would be those that would be willing to vote yes on this bill. I am in favor of stopping these surgeries on minors, stopping these puberty blockers on minors. I've been in favor of that. In fact, for 3 sessions, I have introduced legislation that would do a statewide ban and prohibition on that. However, we have never had the opportunity to even consider or vote on those bills. We could have stopped this before it even started happening. We could have stopped it before taxpayer funds and resources were being used for this. But it was not deemed a priority. It was not deemed something worthy of our attention. It wasn't until tens of millions of dollars were attached to this that all of a sudden it became deemed necessary that we do something on this. And the something has seemed to be the bare minimum. In fact, just up until yesterday, the bills that were introduced to address this didn't even have an emergency measure. So we were going to do something in 90 days. The money could be spent before that, but we were going to stop these surgeries and these puberty blockers in 90 days. It wasn't until I pointed out that there was no emergency measure that all of a sudden that became a consideration, that this was elevated to an emergency to stop this solely at OU. Let's be abundantly clear. This does not stop minors in the state of Oklahoma from having sex change surgeries. It only stops it from happening at OU. This does not stop them from getting puberty blockers. It only stops it at OU. This deflects it from OU to anywhere else in the state, to any other governmental entity to use taxpayer funds for these purposes. This does not stop taxpayer funds from going to perform these surgeries and using for puberty blockers. That only prohibits ARPA funds at OU from doing that. And in fact, this bill does not prohibit ARPA funds from being used for sex change surgeries, for puberty blockers, or any of those other things. It just prohibits that from happening on those under 18. Under this bill, these ARPA funds can be used, and I say ARPA funds, these taxpayer dollars can be used by OU to perform sex change surgeries on 18-year-olds. It's been said that we disagree with taxpayer money going to these procedures. I fully support that. I agree that there should not be taxpayer dollars going to these surgeries, going to these procedures. If an adult wants to use their own money for this, that's one thing. But this bill allows OU to use those taxpayer dollars for 18-year-olds, 19-year-olds, 20-year-olds. Yes, they're adults, but we are allowing them to use taxpayer dollars for that purpose. This is a bill that is very limited in scope. I agree that this scope that it is limiting is something that is necessary, that we should limit that. But we shouldn't just have this limited scope. We should have a statewide ban and prohibition on this taking place on minors. We should have a statewide ban on taxpayer dollars going to these procedures. That's not what this bill does. We've been told that OU has already started to scale this back since they've had some attention on it. But then we've also been told, but we need to pass this legislation because they might not follow through with their word. We've been told that we're going to address this next session. That would be great if we addressed it next session, but this is not something that should wait until next session, especially when we've had the opportunity for 3 previous sessions to stop this. I've been around long enough that I've seen when we've been promised, hey, if you just raise taxes now, we'll have reforms next year. If you just do what is needed to be done now with the money, we'll get the reforms next year. This money doesn't even have to be spent right now. We have 2 years to allocate these funds. We could say, you know what? We're going to pause this bill, and we're going to make sure that none of this money, even these ARPA funds, go to any of these surgeries, not just for minors, but for adults. But that hasn't been the priority. That's not what this bill does. We're in special session distributing almost $2 billion worth of money. And if you follow the money, you'll see that unfortunately, that is often the priority. Distributing taxpayer funds is not my priority.
Senator Dom, please hold. Quorum has been disestablished within our chamber. We have to reestablish quorum for further business to proceed. Members, a quorum call has been requested. Please re-enter the chamber. Members, quorum is being established. Please activate. Do we want to vote or just? Okay. Chair sees a quorum. Senator Dom, you may continue with your debate.
Thank you, Mr. President. Members, as I was saying, this bill does not prohibit the sex change surgeries on minors. This does not prohibit puberty blockers on minors. It solely prohibits it at OU. It deflects it and defers it to anywhere else in the state of Oklahoma. This bill does not prohibit taxpayer funds from being used for sex change surgeries. It only prohibits it from happening at OU for those 17 and younger. In fact, this bill, these ARPA funds, allow OU to use those taxpayer dollars to perform sex change surgeries on 18-year-olds. That's what this bill does. For 3 sessions, we have had the opportunity to put an end to this statewide, to prohibit these procedures, to stop the spending of any taxpayer funds to this. This bill is very limited in scope. We have an opportunity to fully stop this across the state. And I'm disappointed that there are those that would be treating this as a political pawn for the purpose of spending tens of millions of dollars when we should be protecting the children across the state of Oklahoma, not just at OU. So for those reasons, I will be voting no, and I encourage you to do the same.
Further debate. Senator Bergstrom, you're recognized for debate.
Thank you, Mr. President. As I have made clear to our caucus in the past, it's my desire that we pass a bill to ban gender reassignment surgeries and treatment on children statewide. And in fact, I'm very glad that leadership has made it clear that that is a goal that they have as well. This bill does not accomplish that. This bill, as you've heard over and over again, is limited to one medical facility. Therefore, it doesn't stop this activity, an activity that I believe is troubling at the very least. It's definitely harmful to children. And I'll tell you why I know that. I have listened to and I have read accounts that by people who have gone through these transitions when they were children, went through these treatments authorized by their parents because they were confused, and then later they regretted it. And later they regretted it, and some, would end up never being able to, girls would never end up being able to have children. And yet they were kids. Their parents said, well, maybe this is best. And then later on, their lives were devastated. It's harmful. I've found it interesting to hear those who are opposed to the language that's in this bill dealing with this issue, their opposition to labels, of calling people names, of dehumanizing Oklahomans by those, and those that are being accused of doing this are individuals like me who are trying to protect our state's children from these treatments, and we're being called religious bigots. I'm sorry, that's a joke. We're told don't call names, and then we're called bigots. We're told don't humanize people, but we're trying to make sure that we respect their humanity by protecting them. We're told don't shove your religion down our throats. And then we get to hear for quite at length, over and over, how we should accept someone else's religious interpretations. We've heard calls for respect and dignity. That's the same thing that those of us who are in favor of this language are calling for. We're calling for protection for these children from medical choices that could negatively impact these kids for the rest of their lives when they're too immature to make these choices. Interestingly enough, when I entered this chamber, I had no idea how I was going to vote on this bill, because 1 minute I'm for it, 1 minute I'm against it. I have issues with a lot of this that you've heard from other members of this body. But I have, I've decided that if this bill, with the language in it, can stop one child from being harmed, then it's going to be worth it. So I'm going to go ahead and vote for this bill. I'm going to vote for the emergency. And it's my hope that when we come back next session, or sooner, if we can get it done sooner, we will run a bill that protects our kids across this state so that we will never be taking and supporting and encouraging this type of harmful treatment and procedure. So with that, I urge your yes vote on this bill.
Further debate. Senator Thompson, you are recognized for debate.
Thank you, Mr. President. Members, I've had opportunity over the last year and a half to work closely with the CEO of Children's Medical Hospital, to work closely with the medical staff, with Dr. Manter, the Chief Medical Officer. And today, I can stand before you saying that OU makes a difference in the state of Oklahoma and the lives and the health of many individuals. It's been mentioned on this floor the good that they've done in times past with our children. I believe they're still doing well with our children. Oklahoma is a better state today because of OU Medical Center. We're a better state today because of their leadership in the medical field. I was privileged to travel to Ohio with the leadership of OU as we went through 2 different children's behavioral health centers. We were looking for best practices, and the reason we were there is because up until we started this conversation, we turned either our most vulnerable children out on the streets or we sent them to another state for care. We've had children who have been sent to facilities in the state of Oklahoma that didn't have room for them. They've been turned back into DHS who cannot hold them. They have been set free, and some that have been either stricken by a car and died, which is a true story, or those who have died by other means because they did not get the mental behavioral health that we've had. We started down this journey with a premier institution who I still believe is a premier institution in the state of Oklahoma, to solve a problem for our children in behavior mental health. And OU stood tall, and they stood ready to help. Whenever that we sat down and we talked about what we have spent the morning on today, is that the Children's Behavioral Health Center that these ARPA funds are going to has 0 participation with the major point of our conversation today. We're talking about children that today are in a room somewhere afraid of what's going to happen to them tomorrow. When we were in Columbus, Ohio, and I noticed that all the beds were in the corners, and I just simply asked them, I said, why is that the case? Because the children we're trying to serve, that's the only place they feel safe is whenever their backs are against the wall. Those who are going to work in this most critical children's behavior center, one place in Ohio, they're actually wearing Kevlar because they're very violent children at times. Not the children's fault, but into a society where they need help. So under the leaderships of Senator Hall and Senator Haste and their working committees that did excellent work, begin to address those issues and bringing it to the forefront that in Oklahoma we can do better for our children in mental health. And these ARPA funds is addressing that particular need. Children screaming, children crying, children needing help. At the end of last session, we passed legislation in the appropriation process to put $2 million at DHS, $2 million. Because we had a child that had been in OU emergency room for 3 months and nowhere to place the child. That $2 million says if you'll take this child, we'll give you an extra $20,000 bonus. And if you can somehow de-escalate this child to where they could live in another facility, we'll give you a $15,000 bonus. These children not only live among us, they walk among us, have cried out for our help. And OU Medical Center and Children's Pediatrics, under the leadership of John Hayes, their CEO, stood tall and said, we're going to answer the need for our children in this state. And somehow in our discussion, and it's been a great discussion, but I don't want us to lose sight of what that does in this bill. When I look at OU and Stevenson Cancer Center, one of the great privileges, Mr. President, of being an elected member of this esteemed body is you get to go a lot of places and see a lot of things. And I've got to confess, Mr. President, I didn't realize the value of Stevenson Cancer Center until I was able to walk through it and learn that they are one of the best in the top 50 in the nation in cancer care. Top 50. U.S. World Report lists them as the best in Oklahoma and growing. Today, whenever that we look at what Stevenson has been able to do, we have 130 investigators, research scientists that are working hand in hand with the biomedical field and manufacturing to attack cancer throughout Oklahoma. Today, you have a 20% better chance of surviving cancer at Stevenson Medical Center than you do at any other facility. It's because of the research that's going on. And now then we say we have an opportunity to take that same experience, that same teamwork, and move it over into eastern Oklahoma. Talk about an opportunity the state has today to stand tall with an institution that has stood tall, answering our medical needs for years, that we begin to make a difference in the lives of people. So at Children's, I know those personally who have been there as children. And OU stood tall, and today they're leading quality lives. And I know individuals that are later in their life or midlife that has been able to go to Stevenson and walk away from there saying, I'm so thankful that I got the treatment I got in Oklahoma, because now they're back for their families, not just holidays, but every day. When I look at this bill, it has $44 million in it for medical records. That's important because whenever that we go to the hospital, time is of essence. There's not a need for us to go back through all the paper and try to find out what's been done on me. Try to help me or try to help my family member. OU has stood tall, and they simply says, we want to give the best care we can, but we need the medical records to be able to do it. And so today, whenever I look at their finances, and that's my job as the appropriations chair, there's been talk about, and sometimes, that we can say, well, they've got money in this fund, they move in this other fund. First of all, we have the oversight. Second thing is, if you start shifting funds around, you could wind up answering before a judge why that happens to be true. I have confidence in the chief financial officer at UHAT. I have confidence that they're telling us the truth. I have confidence those funds are being used as they are to be expended to be used. And so, Mr. President, I do rise in support of this bill today, and I know we've had a lot of conversation, but I rise in support of this bill today being thankful for OU Medical, being thankful for the Children's Hospital because of the quality of lives that they had, and being thankful that they've answered the call to address our most critical children in this state with a state-of-the-art premier behavioral health center. I rise in support of this bill because of the good work that Stevenson Cancer Center has done and will do more in the future. That's impacting the lives of every Oklahoma, and certainly cancer has impacted all of our lives, either personally or a family member. And I rise in support of this bill today because of the electronic medical records that's in this bill will make OU, which is already a great hospital, will make them a better hospital to serve the people of Oklahoma. And I encourage a yes vote on this bill.
Will there be further debate? Conference committee report. Seeing no others, Senator Treat, or Pro Tem Treat, you are recognized to close debate on the conference committee report for Senate Bill 3.
Thank you, Mr. President. Thank you, members, for your questions, your debate. Whether you agree with me or disagree with me, I appreciate the dialogue. Thank you, Senator from Broken Arrow, who has put a lot of work in many of these ARPA bills, this one included. I appreciate the work of Senator from Perry and Okema and all those, including the gentleman from Broken Arrow and members of both the Republican and Democratic Party who have put in multitude of hours to get this process to where it is. There's been a lot of talk today. I appreciate the Chairman of Appropriations drilling us back down to what this bill actually does on all the spending. There's a tremendous amount of good that we're able to do with this money. We have once-in-a-generation type opportunities to make critical investments in Oklahoma's infrastructure and in Oklahoma's mental health. And our bills reflect that, including this one. It's been said that this is the provisions in UHAT are policy discussions, not appropriations decisions. I would posit that all budget decisions are driving policy. When we made a decision to invest in DDSD to end the waiting list this year, that was a policy decision with money backing it up. When we, over the last few years, have invested an average of $6,200 in teacher salaries, that was a policy decision. When we're investing in a later bill in the mental health and well-being of military and first responders, that's not merely dollars on a page. That is a policy discussion. They are inseparably intertwined at all stages. I think the Chairman of Appropriations has a moniker in his office that talks to that. I don't have it memorized, but I walked in there this morning and saw it when I was there when they're already budgeting for next year. I know there have been many hours of work. I appreciate Oklahomans for submitting the nearly $18 billion in needs, and we only have 10% of that to be able to dole out. Many worthy projects didn't make the cut. We identified nearly $80 billion in water infrastructure that needs to be updated in Oklahoma, and our money falls woefully short. For those who want to send the money back to Washington, D.C., I worked for the late, great Tom Kirburn, and he would have smiled upon that in some ways, but this body just in June voted in May and June to create funds saying we were going to take responsibility for those funds and be good stewards of those funds. This bill reflects that stewardship. It reflects, yes, policy decisions. The debate I've heard about medical science seems almost to have a hubris about it, that somehow we are fallible, but medical professionals are not. And history says a different story about that. If you look in the sad days of the 1920s and 30s when eugenics was the medical science of the day, our own U.S. Supreme Court quoted medical professionals saying that eugenics was justifiable to sterilize people against their will. We had decisions probably in this chamber and the chamber across the way. I don't know that for sure, but I know that was the mode of the day in the 1920s and 30s. And they probably stood on this floor and said, trust the medical professionals. It's in a manual. It's protocol. These people's life don't have value. We are saying today that every life has value. We are also saying that the age of consent is important. That when a person has the mental ability, the capacity to make decisions is important. That's reflected throughout our statute books. It's reflected in Title 21. It's impacted in Title 15. I saw it in Title 63. It is replete throughout the statute books. This is entirely consistent with that. What is also entirely consistent is our desire that the best health care is given. I have a tremendous amount of respect for healthcare professionals. My deceased grandfather was a medical professional that when I was young I thought was the second coming. I loved him, still love him to this day, even though he has been gone for a long time. But I wanted to follow in his footsteps in the medical profession, but life had twists and turns that took me in a different direction. But those people that put the white coats on, those people that are in the research labs, it's an ever-evolving understanding of human physiology, mental health, and to think that it is infallible and untouchable is lunacy. I ask you members to do a lot of good. I ask you to vote for the money at UHAT, but I also ask you to vote for the money that goes to Stevenson, will go to Stevenson and treat cancer, will go to mobile dental clinics, will go to medical records. We are positively impacting the lives of a multitude of Oklahomans, and your yes vote will help do that. I further encourage you to vote for the emergency. If you do not vote for the emergency, you are voting to allow this practice to continue on. If it passes for another 90 days past sine die, I encourage you strongly to take the win that you can get today. Many in this chamber and across this state chastise the theory that we could chip away at abortion and end abortion someday in Oklahoma. And they said it's all or nothing, it's all or nothing, it's all or nothing. That is, in the light of the Dobbs decision, completely wrong. What we were doing worked. We do not have abortion in Oklahoma today. I ask you to trust the word of me and others in this leadership that we're going to continue to pursue this policy. Next session, I ask for your yes vote on this bill and on this emergency.
Members, that concludes debate on the conference committee report. A roll call has been requested as to the adoption of the conference committee report. If you favor adoption, you will vote aye. If you oppose the adoption, you will vote nay. Clerk will open the roll. Those wishing to vote or change their vote, chair is preparing to close. Senator Brooks, Senator Burns, Senator Matthews, Senator Pemberton. Chair is preparing to close. Close the roll. Having received 32 aye votes and 12 nay votes, I declare the motion to be adopted. Members, Senate Bill 3 is before you on fourth reading and final passage. Will there be debate on the bill? Seeing no debate, the vote will now occur for adoption of the bill. All those in favor signify by saying aye. All those opposed, all of those in favor will vote aye. All those opposed will vote nay. Clerk will open the roll. Those wishing to vote or change their vote, chair is preparing to close. Close the roll. Senate Bill 3, having received 31 aye votes and 13 nay votes, I declare the same to have passed. Now, Pro Tem Treat asks that the vote on the bill be considered the vote on the emergency, giving those the right to change who so desire. Will there be changes? Will there be changes? Senator Merrick from a nay to an aye. Further changes. Senator Hamilton from a nay to an aye. Seeing no further changes, I declare Senate Bill 3 to have been adopted as an emergency measure, having received 33 aye and 11 nay.